Caffeine, is it good or is it bad? Does it cause cancer or does it not? How much is safe to drink? Let's finally break down the pros and cons in today's video. If it's your first time here, I'm Dr. Majd. Consider subscribing to this channel for up-to-date medical topics, news, and headlines. A 2018 California court ruling got everybody nervous about consuming caffeine again, requiring coffee to be labeled as a possible carcinogen or cancer-causing agent. However, they just recently removed this warning requirement after reviewing the literature. Why did this even happen in the first place? Well, roasted coffee has acrylamide, which has been linked to cancer in animals. However, human studies have not produced the same link. In fact, numerous studies have shown the opposite, that it may actually help reduce the risk of cancer in humans, or at the very least, does not increase or decrease risk in either direction. You may have heard about a much larger study that just came out this summer of 2019, and I'll place a link to that down below in the description, studying 316,000 people in the United Kingdom. The study did not find a link between coffee and overall cancer risk, nor specific forms of cancer, including breast, ovarian, lung, or even prostate. The consensus in the medical community, and according to the American Cancer Society now, is that there is no evidence that coffee causes cancer. In fact, the World Health Organization removed coffee from its list of possible carcinogens in 2016. Now, when we think of caffeine, most of us think of coffee or tea. However, don't forget soft drinks, energy drinks, chocolate, and even some dietary supplements. Yes, the consensus right now is 400 milligrams of caffeine per day is safe in most adults, which equates to about 4 cups of coffee a day. Note that this does not pertain to kids, pregnant women, or breastfeeding women. Now, 1 cup of coffee is about 80 to 100 milligrams of caffeine. 1 cup of tea is about 30 to 50. Soft drinks are about 30 to 40. Note, decaf coffee has anywhere between 2 to 15 milligrams. Yes, it is not completely caffeine-free. Beware of weight loss supplements. If there's any takeaway I can give you from today's video, it would be that it contains pure and highly concentrated caffeine in powder or liquid form often, which can be lethal. Just 1 teaspoon of pure powdered caffeine is the same caffeine content as 28 cups of coffee. All right, so before we review the pros and cons, note that most of all the findings that we have on caffeine are based on observational studies, which means subjects are simply observed through time. It's not the most ideal type of study, but it's not the worst either. So I'll share some of the links to them in the description down below. Although we need more and better studies, here's what these studies so far suggest. Let's go for the pros first. Now, up to 3 cups of coffee a day may actually protect heart attacks. Caffeine can decrease the risk of diabetes and improve blood glucose levels in diabetics. It can improve mental alertness and cognitive performance. For example, those patients with ADHD or attention deficit hyperactivity disorder, a lot of the adults come into my office telling me that they're drinking caffeine intuitively because it's helping them with concentration. If you think about it, that's also why we tend to go for that cup of joe first thing in the morning. Caffeine can help stop migraines or headaches. For example, the over-the-counter Excedrin, it has Tylenol, aspirin, and 65 milligrams of caffeine contained in the extra strength version of it. However, recent studies showed, note, that 3 servings of caffeinated beverages is actually the tipping point for causing the opposite, meaning inducing migraines, so be careful. Caffeine can decrease Parkinson's risk, except in those women on hormone replacement therapy. For some reason, they have increased risk. There's also a possible small protective effect against Alzheimer's, but the studies are currently just in mice. Coffee specifically may also help improve constipation. Big bonus there. Now, caffeine is a stimulant, perhaps the most widely used one in the world, and does have some proposed risks. So here are the cons. It can exacerbate anxiety and panic attacks in people that are more susceptible to it. It can cause insomnia, especially if you consume it in the evenings. It can cause tremors or shakiness, urinary frequency, especially in women or men who have urinary incontinence. It may not be a good thing. Very heavy coffee intake may trigger heart palpitations and arrhythmias, also in susceptible people. It can mildly elevate blood pressures, but honestly, no more than about 10 millimeters of mercury. I mean, I get asked that question a lot. So if your blood pressure is 180 systolic, when you come into my office, it can't all be because you had that 1 cup of coffee right before you came. Sorry. Coffee can interfere with calcium absorption and hence low bone density, but not tea, interestingly. Pregnant women should avoid it. It can interfere with fetal growth and possibly contribute to premature labor when consumed in excess especially. A few tips, here we go. When selecting your caffeine source, opt for coffee or tea. They're generally healthier and they contain antioxidants, whereas sodas and energy drinks are just completely loaded with unnecessary sugars. If you're drinking excessive amounts and you want to cut down, do it gradually. Otherwise, withdrawal can cause headaches and anxiety, although it is not life-threatening, but annoying. But overall, if you indulge in that 1, 2, or even 3 cups of Joe in the morning without any negative consequences or symptoms, don't beat yourself up over it. Just don't overdo it, use common sense, and enjoy it. Cheers. If you found the information valuable, which is always my goal, please subscribe, ring that bell, like, and consider sharing with someone else who may find this video useful. Well, thanks for tuning in. Stay healthy, and I'll catch you next time.